Chronic pain is estimated to affect 1 in 5 adults, yet it often doesn't appear on blood tests or scans, leaving many people feeling dismissed or without any answers. But a new study is illuminating why this type of pain is often discounted and how it can be better assessed and treated in the future. Joining me now to share more about this is Etienne Vachon-Presseau, who is the lead author of the study and a member of McGill University's Allen Edwards Center for Research on Pain. Hello, Etienne. Thanks so much for being with us.
Thanks for having me.
Okay, let's start off by talking about chronic pain. It can seem like a very broad term. What is it exactly, and why is it so difficult to diagnose?
Yeah, that's a good question. Chronic pain is a very deeply personal experience that is somewhat difficult to measure using standard medical tests. One good example is how medical imaging of tissue damage, once we have an injury, is actually a poor predictor of how people will experience pain. And overall, that's because what the patient is feeling is not just determined by the physical damage, but also by other personal factors, such as, for instance, sleep quality, stress, and mood that can all contribute to that painful experience. So overall, there is not a one-to-one associations between the manifestations of a disease or an injury and how pain is experienced or felt by the participant.
And of course, that's really the focus of this study. So tell me what it entailed exactly.
Yeah, so what we did is we used large existing data sets, such as the UK Biobank, that have about 500,000 participants. And that allows us to do machine learning, where we train algorithms to identify biomarkers that can be either changes in the brain, genetic predispositions, or inflammatory blood markers. And what we see is that these biomarkers that we identify were capable of predicting some of the clinical conditions associated with pain, such as rheumatoid arthritis and gout, and we were capable of forecasting their evolution in time. What we couldn't do with these biomarkers was, however, to predict the subjective experience or feeling of the patients in the study. Once we added psychosocial factors, such as sleep quality, stress, and mood, amongst others, we were capable of not only improving our capacity to make these diagnoses or predicting their evolutions, but we were also starting to be capable of predicting how pain is subjectively experienced by the participants.
So what were kind of the main takeaways from this data that you compiled?
So the general idea is that we believe that we need to move forward a more holistic approach, meaning that to really understand complex phenomenon such as chronic pain, we need to look at it in its whole. So not just focusing on the biological manifestations of the disease, but we need to move towards more a patient-centered experience. So if we want to improve, for instance, treatment or diagnosis or forecasting of the evolution of the disease, we need to consider individual factors such as these psychosocial variables that are really entangled with the biological manifestations of disease.
And this could help doctors, help professionals down the road in how to treat this type of pain?
Yeah, we really hope so. We really hope that this can improve treatment quality or the approach, but this is already what we're starting to see or already seeing in tertiary care units, where the treatment is not just about the condition itself, but it's also to try to understand the patient as a whole and propose more tailored therapies that can be long-term therapies, such as psychological support, for instance, that can improve some of the conditions.
So you say this study also sends a message to people living with chronic pain. Tell me about that.
Yeah, so the idea is really to acknowledge and recognize that their pain is real, even if not picked up by medical standard. That pain is really complex. Again, it's not a one-to-one relationship between disease or manifestations of injuries and how it is experienced. There's variability between individuals, and we need not to dismiss the patients. We need to really listen to them and really integrate their personal history into tailored treatment approach to help them better manage their pain.
Really fascinating stuff. Okay, we will leave it there. Thank you so much for your time.
Thank you.